we are focusing on the left atrial enlargement. And this one is increase in size of the upper left chamber due to increased pressure inside the left atrial upper left heart chamber. So it is sustained with high blood pressure and valvular disease. And this one results into scarring and injuries of that chamber. So you can see the left atrium ballooned, always it balloons. Atriums always balloon in terms of enlargement, whereas the ventricles hypertrophy, this one balloons. So the population at risk of developing left ventricular pressure is people with high blood pressure, patients with mitral valve diseases, aortic valvular disease, coronary artery disease, certain kind of cardiomyopathy, diastolic dysfunctions, left ventricular hypertrophy, congenital heart disease, aortic valvular stenosis. In rare cases, if there is a mass or a tumor in the left atrium, atriovenous fistulas, people who do a lot of training resulting to what enlargement of the heart, they are commonly called athletics heart, diastolic dysfunction in the left ventricle, left ventricular failure, ventricular septal defect, and patent ductus arteriosus. So in a study done in Italy, it is showed that 12% of the people have left atrial enlargement during the period of 10 years. That means it is not rare in the general population. Commonly, in the age of 40 to 50 years, the symptoms of left ventricular hypertrophy is asymptomatic most of the time, but the underlying cause symptoms supersedes the condition itself, and some of them are like fainting, tiredness, heart palpitations, weight gain, difficulty in breathing, sweating in the upper and the lower limbs, chest fluttering. So the diagnosis is based on doing ECG, and the key part is the P wave, where the P wave is larger than normal. If the P wave is more than 120 milliseconds, that means most likely you are dealing with a case of left ventricular, left atrial enlargement. Sorry. So other tests you can do thoracic echocardiogram, and also you can do cardiac CT scan, or you can do MRI. This is the normal ECG. This is the P wave, the normal P wave, but in a left atrial enlargement, this is how the P wave appears in this lead. In the 5-1 lead, it looks like this. So the treatment of left atrial pressure is reversible if it has occurred for more than a week. But the key thing is that you treat the underlying cause, for example, by requesting the client to do exercises, stop the use of tobacco, eating food low in salt, taking blood pressure diseases, having a procedure to correct the valves, taking medicine to reduce symptoms of valve problems, taking blood thinners like anticoagulants to prevent stroke, and also taking drugs to control congestive cardiac failure. So the complications is like dizziness, fainting, abnormal electrolyte levels, heart attack, stroke, kidney failure, and abnormal rhythm. So prevention is to keep the blood pressure in its normal range, keep your weight healthy, prevent left ventricular hypertrophy, and stop smoking, reducing the amount of alcohol, preventing heart failure, preventing atrial fibrillation, and hypertension, heart diseases, and stroke. And that is the end of this session.